Hi, everyone. My name is Nicole Jorwic. I'm the Senior Director of Public Policy for the ARC of the United States. I'm glad to be with you again this week to talk a little bit more about what's going on in Washington, D.C. I want to start a little bit differently than I have the past few weeks, though, and start on a little bit of a personal note. Because I know sometimes I'm giving you a lot of technical updates, but I just want everyone to know that this is also something that I'm dealing with on a personal level. I want to take a moment to recognize that the real fear of individuals with disabilities, their families, and the workforce during this difficult time. My brother Chris has autism, and I worry every day about what could happen. He doesn't use his voice to speak, and so if he got COVID-19 and someone wasn't allowed to be with him, what that would mean. His life, my parents' life, has been greatly disrupted. And that's what keeps me going. That's what keeps me fighting. And I know that that's why everyone is here. And those stories and that information is exactly what we need to be sharing with our legislators. And it's why we must continue to go on. We know that people with disabilities face high risk of complications if exposed to COVID-19 or the coronavirus. We also know that the need to social distance is creating new challenges for people with disabilities, disruptions in schedules. We also know that it impacts access to healthcare, the long-term services and supports that people need, special education, housing, transportation, technology. There's no part of the lives of disabilities and their families that aren't being impacted. We also must work to ensure that the rights of people with disabilities are protected through the pandemic. The ARC and other organizations have been working to challenge any state that creates what's called care rationing plan to devalue the lives of people with disabilities. As I've talked about during the past month, some progress has been made in the initial congressional packages 1, 2, and 3, that provide some relief, but it's abundantly clear that more support is needed specifically for the disability community. One really exciting development that I did want to share that's new this week is that thanks to the advocacy of people like all of you, and including advocacy from our staff, from my colleague Bethany Lilly, the Treasury Department announced today that it would they announced yesterday that it would automatically issue the recovery rebate payments to people with disabilities who receive supplemental security income, or SSI, via the method by which they usually receive those benefits. So there wouldn't, as you might recall from a few weeks ago, I had said that if somebody who is on SSI or SSDI might need to file taxes. A couple weeks ago, we got the clarification on SSDI, and now we got the clarification on SSI. So that's really good progress, and it means that people with disabilities and their families won't have the undue burden of having to file taxes to access those recovery rebates. As Congress works towards the next COVID-19 relief bill, there's a few other things that will happen. There have been 3 packages that have passed, and there will also be what's being called Package 3.5. That package will not have specific funding in it for disability services, but it will have additional funds for what's called the Paycheck Protection Program. And those are small business loans that small nonprofits like Chapters of the ARC and other service providers can apply to. So the fact that those are going to get additional funding is a positive. They may act on that this week or next week. But Package 4, Congress announced this week that they're not coming back now until May 4th. And so what that means is that we have a great deal of time to advocate. They're going to still be home. They're going to be in their districts and in their states. And so it's really important that we're reaching out about our priorities. It also means that we won't anticipate seeing Package 4 come together until probably early May. I'm going to go through those specific asks that we want to see in Package 4, so that you know what you should be reaching out to your legislators on. Home and community-based services. This is a really important ask, and honestly the biggest ask of the disability community. We're pushing for an increased FMAP. There was a 6.2% FMAP bump. And the FMAP bump, again, is an increase in federal dollars to match what state Medicaid spending is. There was a 6.2 bump that was included in Package 2, but we know that state Medicaid programs need more assistance. But the biggest ask is to pass the To Assist Older Americans and People with Disabilities Affected by COVID-19 Act, not the most catchy title, but what it will do is create HCBS grants to support direct support professionals, personal care attendants, and home health aides. It also will just create more access to home and community-based services so that people do not end up in congregate settings, nursing homes, institutions. There are still 36 states that have institutions open. We are also making asks around medications and treatments, ensuring that all testing and treatment for COVID-19 is provided at no cost to individuals, whether they are insured or not, and that people with disabilities and the workforce have access to personal protective equipment or PPE. This is a major issue. We have folks that are volunteering to sew masks, then that's great, but we need to make sure that there are medical grade equipment that the workforce that supports people with disabilities need to keep themselves safe and also to keep individuals with disabilities safe. Around paid leave, we want to extend paid sick days and paid leave provisions to caregivers who can't work because they need to care for an adult with a disability or an aging family caregiver. Right now, that's only available for parents, but for siblings like me, we want to make sure that that's a broader definition. And we also want to make sure that the rights of people with disabilities are recognized and that people also don't end up unnecessarily institutionalized. I want to make a point around institutionalization at this point. I know that Arizona does not have any institutions, but unfortunately, there are nursing homes or what are called ICFs, intermediate care facilities. And unfortunately, what we're seeing is that almost every nursing home in many states have these cases. And so if people with disabilities end up unnecessarily in a congregate setting or a nursing home, they're at a greater risk. So that's really why we need to push the HCBS grants as the #1 ask for the community, because we can't allow systems to move backwards. And in order to do that, we need to invest in home community-based services so that people don't end up away from their families and away from their community. Don't forget there are also weeks of action coming up. I mentioned those last time. Next week we're changing it to, it was originally supposed to be about the SSI glitch that we got fixed, so we're changing it to medical supplies and the personal protective equipment. So there's some sample social media that the ARC has on its website and anyone can use. And the following week, the week of April 27th, the week before hopefully Congress is going back, we'll be focusing on those very important home and community-based service grants. So it's really important to take action, film videos, tell your stories, talk to your legislators, because it's really important. After being all but ignored in the first 3 legislative packages that Congress has passed to address COVID-19, we really must, as a community, continue to rise up. The asks of our community were and continue to be clear around this crisis, recognizing we must ask Congress to recognize that whether it's individuals with disabilities, their family members, or the direct support professional workforce, we are essential. Thank you so much and be well.